Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Tests for the evaluating the attention, then the concentration as well as the memory. So first let's focus on the topic of memory. So in memory, the memory is of three types. One is the immediate memory, recent memory and the remote memory. So let's focus on the immediate memory. So under the immediate memory, it is the immediate memory and recall. It is known as immediate memory as well as the recall. So they are usually tested by digit span or the digit repetition test. So what is meant by the digit span? So digit span test means that the digits are spelled at a rate of 1 digit per second. So you have 1 digit. So 1 digit is given per second. 1 digit per second. And it is of two types. One is digit forward and the digit backward. So you have digit forward as well as the digit backward. So first is the digit forward. Digit forward is a reproduction of increasingly longer digits. So digit forward is increasingly longer digits. And here the examiner says, say 2, 4, 8. And the person has to repeat in the same order. Suppose you say 2, 4, 8, the person again has to repeat in the same order. This is the digit forward. So digit backward means, suppose for example, if you say 1, 3, 5, 7, 9, this is the digit backward. So digit backward 1, 3, 5, 7, 9, the patient has to repeat 7, 9, 7, 5, 3, 1. So it is a repeat of the backward. Suppose the test should be stopped when there are two successive failures. So you stop it when there are two successive failures. And hence two skipped are not allowed. So hence two skips are not at all allowed. Next is the concept of the recent memory. So what happens in terms of the recent memory? So here in terms of recent memory, ask them how they reached the hospital or what they ate for breakfast. So you ask them what is for breakfast. This will deliver the recent memory. Or asking them how they came from the hospital. So all this will deal with the recent memory. Next we'll look at the remote memory. So here in remote memory, it's a relevant question from the past, like for the close relatives' birth dates. So remote memory will be like remembering the birth dates of the relatives, important birth dates or important events. Then we move on to the attention. So attention is the patient's attention easily aroused or sustained. So you look for if the patient's attention is easily aroused. So easily aroused or is it sustained? Sustained. Next is we have the digit span test. The digit span test. Then we look at the concentration. Next we look at the concentration. So concentration is the patient is easily distractible or they can concentrate. So can you concentrate or not? And a serial subtraction test. Serial subtraction test. So serial subtraction test is the minimum of 5 subtractions done serially in order to take it into account. So you have 5 successive. We have to do 5 successive subtractions. Next is count backward from 20. So this is for concentration. So in concentration, the next was the count backward. So you count backward, and this is from 20 you count backward. Then enumerate the month in reverse order. So you enumerate month. So enumerate the month in the reverse order. So all this will tell if you are concentrating or not. So it is a concentration. To learn and grow daily like this, please do subscribe.